I am Dr. Srikanth Gadiyaram, surgical gastroenterologist with a practice of about 2 decades in Bangalore. I did my medical education in Premier Institute, JIPMER Pondicherry. Later I did my masters in surgery, again in JIPMER Pondicherry. And following my masters, I moved to Mumbai, where I worked in Breach Candy Hospital for about a year and a half under Professor Tempton Woodwardia, who is a pioneer in laparoscopic surgery. In the year 1998, I moved to Lucknow, Sanjay Gandhi Postgraduate Institute, where I spent 4 years. The later 3 years did my MCH super specialization in surgical gastroenterology. In the year 2002, after completion of my specialization, I moved to Bangalore to Manipal Hospital as a consultant in surgical gastroenterology. Now I had a decade long period at Manipal Hospital where I was involved with a variety of gastrointestinal surgical procedures and we had treated more than 5,000 patients during my stay for a decade there. And my focus was always to build laparoscopic surgery and apply laparoscopic surgery in all the areas of gastrointestinal surgery. At Manipal, I started the bariatric surgery program in 2006. I started the single incision laparoscopic surgery program in 2009, and we have the largest experience in single incision laparoscopic surgery of more than 250 cases, not only for routine procedures like gallbladder and appendix, but also a single incision laparoscopic surgery for complex procedures like colectomy, total colectomy, distal pancreatectomy, splenectomy, and so on. In the year 2010, we did our first laparoscopic Whipple operation, which is a formidable operation to be done as an open procedure. So later in the year 2011, I moved to global hospitals at Uttarahalli, wherein I spent the next 6 years as the Director of Gastrointestinal Services. Here we established the center as a pioneering and the best gastroenterology setup in the entire state of Karnataka. By this time I had finished 15 years of practice in Bangalore, and I always felt there was a need for the common man to have access to these advanced laparoscopic procedures, which I was proficient in and had set up a team of people who could do these procedures. Now, this was not in the reach of common man several times because of cost considerations. Also, in any service, dedicated personal service is something which is lacking in the large corporates. Although the systems and processes are in place, you cannot give a personalized care. With that in mind, I wanted to, but the idea crystallized to start Sahasra Hospital, a standalone center for digestive surgery. This was started in the year 2017, and we have performed more than 1,000 operations. And I am so happy to say that standalone centers can function to do complex operations, and we have a liaison for certain needs of any specialty, such as cardiology, such as diagnostics, such as angiography facilities, with several centers which offer these services. So we have tie-up with these centers. So we are able to perform the vast majority of complex procedures which are not even performed in many of the corporate hospitals in Bangalore.